Welcome! Your healthcare provider has prescribed Philips Mobile Cardiac Telemetry, MCOT, for you as a diagnostic tool. The MCOT system conducts a beat-by-beat analysis of your heart activity and transmits certain abnormal heartbeat recordings to Philips cardiac technicians. Our trained technicians monitor ECG data and look for specific heart activity 24 hours a day, 7 days a week, and in some cases, may contact your healthcare provider. Clinical reports are made available to your healthcare provider to review during and at the end of your service. This video will help you get started with your monitoring service, explain how to record an event, and provide some tips to help you successfully complete your monitoring service. As this video guides you through the entire process, we encourage you to take your time and pause this video at certain points to ensure you have completed each step of the process properly. Before getting started, open your MCOT kit. Remove box 1 and open it. As a reminder, MCOT is not an emergency response system. It is a diagnostic test. The monitor cannot be used to make outgoing calls, even during an emergency. It is important to properly prepare your skin before starting the setup process. To assist you, please watch all steps before beginning to prep the skin yourself. It is important that you prepare the left side of your chest. If you have hair on the left side of your chest, you will want to remove it. Then, wash and fully dry the area shown in the circle. Once your skin is dry, scrub the area with the provided scrub pad for 1 minute. Take this time to pause the video and prepare your chest. Remove the sensor and a patch. Place the sensor onto the blue plastic cradle of the patch. Press down firmly to snap it securely in place. You may hear several clicks. Ensure no gaps are visible between the blue cradle and the sensor. A green light will flash for about 30 seconds, indicating the sensor is working. If a red light appears, call patient services at 1-866-426-4401. Now locate the patch placement template under box 1 and follow its instructions for use. This template will help you place MCOT on your chest correctly. Place the drawstring around your neck so the card lays by itself on your chest. Use a mirror for guidance to assist with proper alignment. Take this time to pause the video and apply the template. Next, pick up your MCOT and begin the simple process of attaching it to the cleaned and prepared area of your chest. Remove the clear backing and apply the patch to the left side of your chest, using the template as shown. Remove the template and use your fingers to press the edges of the patch firmly against your skin. Once fully adhered, find the edge of the top white paper and carefully peel it off. Next, we will set up the monitor, which is also the phone. The monitor is an important part of the MCOT system as it transmits that data from your heart to the cardiac monitoring technicians at Philips. To turn on the monitor, press and hold the power button. Follow the on-screen guidance to complete the setup. Select a language to continue. When you see this screen, press Continue. You are now greeted by the welcome screen on the monitor. Select Next and verify your identification. If the name that appears on the screen is yours, press Yes. If the name that appears on the screen is not yours, please contact Patient Services toll-free at 1-866-426-4401 for assistance. You will be prompted to accept the terms and conditions of the service agreement. Additionally, you will be asked to agree or disagree with the data terms in order to begin your service. The Wear and Care screen will guide you with a few helpful tips during your MCOT service. Continue completing the setup process. When you see this screen, the setup process is complete. Congratulations! You completed the setup process. The remainder of this video will review information that you will need to know while monitoring, including how to record a heart-related symptom. Now we will review some important information to keep in mind throughout your MCOT monitoring period. While MCOT monitors your heart and sends data automatically to Philips ECG solutions, you can also record symptoms, also known as events, as you feel them. Your recordings will appear on the reports provided to your healthcare provider. To record a symptom, press Touch to Record Event on the main monitor screen. Then select the symptom or symptoms you were feeling. Select all that may apply. Select Next to continue. Record your level of activity when the symptom occurred. Select Done. The Event Recorded screen confirms that your symptom was recorded. Press OK to return to the home screen. MCOT should be worn as directed by your healthcare provider for the entire duration of your prescription. Here are some tips to help you successfully complete your monitoring service. Keep the monitor in close proximity to you at all times. Do not remove the patch from your skin after you begin monitoring. With normal wear, each patch should last 5 days. There are enough patches in the kit to complete the full monitoring duration prescribed by your physician. Additional patches are located in Box 2. MCOT worn with the patch is water resistant, so you can shower and exercise as normal. However, MCOT is not waterproof. Please do not swim or take a bath while wearing MCOT. Alerts on your monitor let you know if an action is needed. Therefore, it is important to address all alerts on your monitor promptly. When the battery on your monitor is low, use the supplied charger. The monitor will show a warning message when the battery is low. Complete instructions for charging, replacing your patch, troubleshooting, and returning your equipment can be found in the maintenance video and the patient education guide in the kit. Lastly, if your skin is irritated or you would like an alternative to wearing MCOT, your healthcare provider or a Philips Patient Services representative may suggest that you wear an alternative wear option that is located in Box 3 of the kit. Please note, the contents in this box are only an alternative to regular monitoring use. To help you with additional tips and important steps you will need throughout your monitoring period, view the MCOT maintenance video or refer to the patient education guide in your kit. For additional support, refer to the patient education guide. Contact Patient Services toll-free at 1-866-426-4401 or chat with a representative online anytime at myheartmonitor.com.
Philips.